but there's just one more big clinical piece that I would bring up, and it's the constipation. It's this feces that you see in the colon here that I think is important to think about when we're talking about clinical concerns for uremic toxins. So let's just talk a little bit here at the end about constipation. We do know that constipation is more common in cats with chronic kidney disease. So this study showed that cats were more likely to present in an emergent situation for like outright constipation. They're in trouble, they cannot defecate, they need to be hospitalized or have enemas, etc. And definitely, I was delighted to see this study because it absolutely fits with my clinical experience that this is a huge problem. But then we also did a study where we looked at like a little bit more subtle take on constipation. How often do cats with chronic kidney disease actually defecate? Are they as regular, if you will, as a normal cat? And it turned out from the results of this survey study, we had people kind of guess what they thought their cat was doing. And then because a lot of people don't know what happens in the litter box, we had them scoop the box for 7 days and fill out a survey every day and tell us what they found. And the result of that study was that usually most normal cats were defecating about once to twice per day, but chronic kidney disease cats, many of them even might be every other day to daily. There was even one cat that only defecated every 3rd day. So there may be subclinical constipation that's occurring even before we get to the part where they're presenting on emergency for not being able to defecate at all. And so for me, very much constipation is a target for a number of reasons. And when we think about why it might be happening in kidney disease, there's a number of issues. And the very first one is hydration, hydration. So when the cat is dehydrated, it basically is going to pull water out of the colon to try to save it back into the body. The kidneys can't do it anymore. They can't concentrate the urine to save that water back into the body. So then the body asks the colon, hey, I need some water back. Could you please absorb that out of the feces? And what do you get? Really dry, hard feces. So that's something that we see very commonly in our chronic kidney disease patients, overall dehydration and pretty hard little tiny feces in the colon, like that radiograph. The other big factor is hypokalemia. And we really think normally about hypokalemia for muscle function, like skeletal muscle function and weakness. But remember that hypokalemia is really quite important for smooth muscle function too, and also GI motility. So I do make sure that I'm checking potassium and that I'm correcting potassium in these patients, especially if they're having problems with defecation. And then phosphate binders as well, you know, we have a problem with phosphorus, and especially if they're eating their renal diet and that's still not helping and you need to put them on a phosphate binder, they can get constipated with phosphate binders, and that could also further slow things down. And then other information that we don't know for cats in particular, but has been shown in other species, is that those uremic toxins, some of them actually have negative effect on colonic motility. So here we come round again, having this problem where the kidney and the gut are interacting with each other. The kidney cannot get rid of the uremic toxins, and then those uremic toxins may be coming back and having a decrease, a prohibitive effect on GI motility. So you have that gut-kidney axis. So there is a little bit of data about that in people. And constipation is associated with higher uremic toxin P-cressyl sulfate in human chronic kidney disease patients. And again, as I mentioned, there's a branch chain fatty acid called isovaleric acid. That's another uremic toxin that causes relaxation of colonic muscle. So it may have a negative effect on colonic smooth muscle. And that one also comes from protein. And it's been shown to be elevated in cats with chronic kidney disease as well. So we do have concerns, again, for those uremic toxins feeding back on the gut. So what do we do? Well, this isn't necessarily a talk about constipation, but here's just an idea of how I normally approach this. Again, my number one thing is thinking about hydration and potassium and making sure those are corrected. Thinking about that elderly cat, is its arthritis being addressed? Can it actually access the box? Is this a cat that fiber might work for? Sometimes that does not work in kidney disease, especially when you have hydration as a problem. And then we start thinking about osmotic stool softeners like lactulose or Miralax, but we have to hydrate them first because remember, those substances, they pull water out of the body into the colon to make the stool softer. So if the cat is already dehydrated, that's going to further dehydrate that patient. So we have to be careful about that hydration balance. And then the other big thing that I would say would be we really have to think about pro-motility agents then. It's possible with this decrease in motility that we might have a concern and actually have to address that. So cisapride is a medication that we sometimes use to help out. But again, the thing that I want to point out is I very much go down this list. All of these things might be necessary, but I want to start with the things that really go wrong with chronic kidney disease. And the last, intriguing piece that I would leave you with there would be that we do see chronic kidney disease rodents that experience decreased uremic toxins, creatinine, and kidney histopathology when they've been given lactulose. So, that's softening the stool, but it might also be providing nutrients to the gut. And I found that to be a really intriguing study. I'd have to say I'd need additional studies, and I would want to see that data in cats as well before I would say that's where I'm going to go. I truthfully tend to use Miralax or PEG 3350, I think is the number for it. That's what I mean by that product for my stool softener when I use it, as opposed to lactulose. But that rodent study was really quite interesting in terms of giving you the idea of how if you moved that feces along and get it out of that colon, then if it's not sitting there, it's potentially not allowing as many uremic toxins to be absorbing up into the bloodstream. So that's what I have overall for thinking about uremic toxins and chronic kidney disease and the gut. And I would say in general, this to me is a huge, new, and really intriguing therapeutic target for us. So the microbiome itself, again, like we said, is abnormal. And those uremic toxins, we know that they're building up in cats. And there are a number of different approaches that we can have in this particular situation to try to say, here are some things that I literally clinically can do at this point in time. So I would hope that I've convinced you today that I am concerned about this particular particular pathophysiologic problem in cats. There are things that we can do, and I'm excited to have more attention brought to this, and also have additional products available to be able to address this.